Welcome to AB Lifetime, channel on transpersonal psychology. Our topic today is sociodrama, and I am so happy to introduce my guest, Rebecca Walters. Rebecca, thank you so much for coming
You're so welcome.
in participating in this interview.
You're so welcome. But it's very different than psychodrama because it is not an individual story. How old is Mike?
Mike is 35 years old.
35, okay.
I'm not sure I can trust you.
I understand. Yeah, I did many things which I'm really worried about my son.
I might ask you to imagine for a minute that they're the person that they need to talk to. Reverse roles and say what they imagine that person's feeling.
So to start with, what is sociodrama and what is its purpose?
Well, sociodrama is a group action method
Uh-huh.
in which participants spontaneously act out a mutually agreed upon social situation. And it uses the same techniques that psychodrama uses. It uses techniques such as doubling, role reversal, concretization, all the things that people who have seen some of your videos on psychodrama would recognize. But it's very different than psychodrama because it is not an individual story. It is a group-created story. Sociodrama, like psychodrama, helps people express their thoughts and feelings and solve problems and clarify their values. But rather than simply discussing social issues, sociodrama gets people out of their chairs and exploring in action topics of interest to them, topics of concern. And as they explore these issues, they put themselves in the shoes of the other people in the situation. They do this in order to understand themselves better and to understand other people better. And often to come up with a solution, a mutually agreed upon solution that they can then take steps to
Like learn the new ways of...
learn new ways or practical steps. So
Right,
for example, I once did a sociodrama on the issue of fracking, which is a real big issue in the East Coast, which is where I'm from. And we had people who took the roles of people who were for fracking and people who were opposed to fracking, and people who were going to be impacted by the fracking. And at the end, people made commitments to what they were going to do about it. Some people said they're going to write letters, others said they're going to seek out more information. So it isn't just about doing it for the fun of it, although it can be. It also gives you some guidance as to what the next step is. One of the reasons it works so well is because sociodrama taps into human truth. And it shows that we are more alike than different. The goals of it may include catharsis, or not necessarily, but certainly developing insight and role training. And so it's very typically used to address situations like, I'm trying to think of some of the sociodramas that I have directed. One's on abortion. We had a sociodrama where people took the role of someone who was very against abortion and somebody who was very pro-choice, and then we had them reverse roles. Right?
Yeah.
With the help of the group. But it wasn't those individual people who were doing it. It was the roles the group assigned them. So it's made up. It's not hypothesis. What's the word I'm looking? Hypothetical. It's hypothetical. And so it gives a little distance. It's not as direct as psychodrama. Because with psychodrama, people are doing their own story.
Yeah.
And with this, it's the group story. It was developed by Jacob Levy-Moreno, along with psychodrama. He had a great belief that you could train people to be more spontaneous, and sociodrama was a great way to become more spontaneous. So it's most often used to address collective issues in the group. So for example, I've directed psychodramas about racism in the classroom, about bullying. These are things that, how to walk away from fights. these are things that it might happen in a classroom setting with children and with teenagers. With adults, I did a sociodrama about re-entry from a psychiatric hospital or drug rehab back into the community. And we had many people at the table. We had the kid, we had his mother, we had his teacher, we had his guidance counselor, we had his outpatient therapist. These were all made up roles from the group members. And we were able to explore all the anxieties that everybody was feeling and then what we could do about those anxieties. So sociodrama has lots of places it can be used. One of the things that I have done is developed a way of using it clinically. So there are many settings in which there's not a very high trust level. And yet people are supposed to come to groups and spill their innermost secrets and deal with their issues. And it's really hard because there's not enough time anymore in treatment facilities for people to feel safe. So sociodrama is a great way to address these issues. For example, I've worked a lot with children. So here's a little boy or a little girl whose father's in jail. And rather than that child have to admit that their father's in jail, we can create a sociodrama about some kid whose father's in jail. You see? So it creates a little bit what the drama therapists call the aesthetic distance. It distances it, and it makes it more accessible. It also is really useful. We've used it with teaching parenting skills at PTA meetings, parent-teacher association meetings, where parents don't want to necessarily admit that they are lacking in empathy or that they get angry too easily. But we can do it as a sociodrama because people don't have to reveal their own story, and yet they're learning the skills. I've also used it a lot in psychoeducation, in teaching DBT, dialectical behavioral therapy, interpersonal skills. Actually in teaching some of the crisis management, what to do when you're trying to get agitated. And I've used it extensively at a major cancer center, teaching doctors how to deal with giving bad news, how to teaching doctors and nurses how do you deal with patients who start to cry or get angry or won't comply with treatment. And these people are not going to admit that they have problems with this, right? But we can do it with a sociodrama and teach them actual skills they can practice sociodramatically.
Oh, that's wonderful. Absolutely wonderful. This is great too. So, Rebecca, you mentioned a little bit about the differences on psychodrama and sociodrama. Could you please tell more about the differences?
Well, a psychodrama is an individual person's story. And when they're doing their own psychodrama, they pick who's going to play the different roles. And they actually show that person how to take that role. In a sociodrama, the group creates the story, and the characters are made up by the group. So in sociodrama, they're shared roles, and in psychodrama, they're private roles. In sociodrama, we deal with collective issues. We deal with issues that the whole group is agreeing needs to be addressed. Whereas in a psychodrama, very often, an individual person comes in distress and wants to work on a topic. Sociodrama is, for instance, it's hypothetical. Psychodrama is real.
Okay.
It's the real story. Sociodrama is generic. And psychodrama is specific. Sociodrama is less revealing. Psychodrama is more revealing. Sociodrama focuses on social, community, collective issues, whereas psychodrama focuses on healing intrapsychic and interpersonal wounds and addressing problems. And the other thing that's different is that in a sociodrama group, you'll have a little bit of action and a lot of sharing. A lot of people saying, oh, this is how I related to this issue. In psychodrama, you have a lot of action and much shorter sharing. And I think the other difference is really where you use them. Psychodrama is probably best used where there's a contract to do therapy. And there's so many places where we're not really contracted to do therapy. We're contracted to help people learn a new skill, or to address issues in the classroom, or to help somebody figure out how they're going to stay sober when they leave the treatment program. And there's not really a contract to do the kind of deep psychotherapy that psychodrama is so useful for.
Mm-hmm. Could you please let us know what is the structure of sociodrama?
Okay. Well, traditionally, sociodrama was done where people would, it's a little bit like role play.
Mm-hmm.
I like to call it expanded role play. The first thing that happens is there's a warm-up. Now, many people watching this have had experiences with role play,
Yeah.
and will say, I hate role play.
Yes. I know.
And part of the reason is because the concept of warm-up, which comes from Reno, was not included. So the very first thing that happens in a sociodrama group is there's a warm-up. There's group building. People get to know each other. And people also have a chance to develop some ease with one another and ease with their own spontaneity.
Yeah.
Okay?
Uh-huh.
And so that's the first step.
Uh-huh.
The second step is to choose a topic.
Uh-huh.
Now, in most of the groups that I have run, I've been told ahead of time what the topic was to be. I was hired to address this topic or that topic.
Mm-hmm.
So the group walks in knowing that's what's going to be addressed.
Mm-hmm.
In more other venues, the person who's directing out of the warm-up will come up with some ideas and throw them out for the group, and the group can choose what they would like to work on.
Uh-huh.
Now, in real typical sociodrama, one that I remember being part of, I didn't direct this one, was one in which there was a husband and a wife, and they were discussing a topic of concern. I think it had to do with money.
Mm-hmm.
Okay? Common conflict. The most important part of any sociodrama is to warm the group up. And warm-ups increase group cohesion, and they increase spontaneity, and then they help the group pick a topic, or they warm up to the topic that has been chosen for them. Now, there are all kinds of different warm-ups. Sometimes they're cognitive warm-ups. Sometimes you go hear a lecture.
Mm-hmm.
Like when I was doing the sociodrama about the re-entry meeting back into the community of teenagers who'd been in a hospital and in rehab, someone before me had given a whole talk about it. So people were sort of warmed up.
Mm-hmm.
There are also affective warm-ups. Affective with an A, emotional warm-ups. That appeal directly to the emotions and to the body. And they're often interactive and physically engaging. The moving adds liveliness to what could be a very dead group.
Uh-huh. I see.
An example,
Mm-hmm.
working with teachers on how to be more effective with middle school challenging students. So where do we start? You know, I'm not going to give them a lecture about it.
Uh-huh.
I'm going to invite them to get up and move their bodies a little bit, and I want them all to become 14-year-olds and all become difficult. And there's lots and lots of laughter, because if you have 20 acting out 14-year-olds all in one room, the adults people just start to laugh.
Yes.
And that alleviates the anxiety.
Uh-huh.
You know?
Yes.
And then we talk about what's been successful for you.
Uh-huh.
When hasn't worked,
Uh-huh.
and when has it not worked. And it's starting with strength-based by saying, you've all had experiences where you've been effective with kids.
Uh-huh.
Let's put on the board, what was that you did that was effective?
Uh-huh.
And then they feel comfortable talking about their challenges.
Mm-hmm. I see.
Right?
Mm-hmm.
So warm-up is terribly important.
Mm-hmm.
So you had asked me about what kinds of structures.
Yes.
Right. So first you start with warm-ups.
Mm-hmm.
Now, the traditional sociodrama is a role play.
Yeah.
So with with a husband and wife who are fighting over money, they start the scene. Two people in the group volunteer and they start the scene, and other people may come in and double for them, which is a psychodramatic term of standing behind the protagonist and saying what you think they're feeling.
Mm-hmm.
Or they may tap out and actually say, let me take the role of the husband, or let me take the role of the wife. I have something to say in this role. And that's a very traditional role play. I did one with a group of 12-year-olds on confronting racism. What they chose to do was a story that took place in the mall where a couple of girls of color were approached by an older white guy who started calling them all kinds of slurs. And how were they going to deal with him? And what's the best thing they could do in that moment? And so we did it as a sociodrama, and they tried out all kinds of different interventions. But I tend to, because so much of my experience was working in patient psychiatric, and also working with kids and teenagers, I'll just pull out a chair. This is one chair, and I'll say, this is somebody who, right? Here's a mother whose teenage son didn't come home last night. And I begin with, you, give me a name for her. Tell me how old she is. I get the group to create the character. I invite someone to sit in the chair as that character. And then I invite people to come and stand behind and say all the different things that person might be feeling. That could be enough of a sociodrama.
Yes.
And now go sit down and share. Other times we might have a chair for the teenage son. And we have the same thing. What's his name? How old is he? Where was he last night? Come stand behind him. Let's see what he's feeling. And then we can begin to have a dialogue. Right? And then people sit down and share. How do they relate to it? Sometimes I just do a line. With another structure, I call it the sociodramatic line. Right. And that might be, like I described before, the reentry meeting was, here's a chair for the kid, here's a chair for the kid's mother, here's a chair for the school teacher, here's a chair for the principal, here's a chair for and I got the group to tell me who's at the table. And so they came up with 6 or 7 chairs, and I invited people to double them. But there was no crosstalk. In this particular setting, what I was focusing on was just having the group members, there were 60 people in the room, just be able to begin to identify feelings of someone in a different role. I ended that sociodrama by having everybody in the group, who were teachers and parents and school counselors and principals, from their own role in real life, say one thing to one of the people on the stage that they could do to help make it easier. So I'm the principal, and I want to say to you, Mom, I really get how you're feeling now, and I'll make sure that we have a meeting the day after he comes back to school. I'm a teacher. I'm going to say to you, school counselor, I really understand now why you can't see him whenever I need you to see him, because you have 45 other kids to see that day. And so what I'm going to do is, and we did a lot of that kind of stuff. So it was a sociodrama, but it ended with people in their own true roles.
Right.
The role circle is really fun to do, because I don't know, the fun is quite the right way. It's a very effective way of working. I did it at the Cancer Center. The group decided who the patient was. The group decided who the other people in the patient's life, sitting in chairs in a circle, right?
Yeah.
And the doctor, the nurse, the social worker, the pastoral counselor, the patient's teenage kids, the wife, the ex-wife. And after they began all talking and dialoguing, I said, everybody stand up and move 2 seats to your left. And all of a sudden, everybody's thrown into a whole new role. Now, that's what I did when we were discussing abortion. So the people taking the role of being very anti-abortion and the role of being very pro-choice, I saw how far apart they were in the chairs. There were like 8 chairs. I said, everybody get up and move 4 chairs to your left. So all of a sudden, they were in totally different positions. And they had to find it, Yeah. We did an amazing one like that on child labor. Now, like most Americans, I'm totally opposed to child labor. I mean, this is horrible, putting 8-year-olds to work, right?
Uh-huh.
But it was very interesting because somebody in this circle said, I'm the father of that child. Our children have always worked. They've worked in the fields. Now they're working in a factory. If they don't work, we don't have food. What do you want me to do? And that was an eye-opener to those of us who had the knee-jerk reaction, child labor is bad. Yes, child labor is bad, but we can't just pretend that if we stop it, the problems are going to go away.
Mm-hmm.
So that was really interesting.
Wow. Uh-huh.
So I always learn something when I do
Uh-huh.
sociodramas. We also sometimes do very symbolic work. I know that when 9/11 happened, so I live 90 miles north of New York City,
Yeah.
and when 9/11 happened, that Friday night, people showed up at the Psychodrama Theater. It was crowded, it was standing room only. People needed to be together.
Uh-huh.
And we worked very symbolically. You know, we actually created the World Trade Center on the stage using the balcony for the top. And people got into the roles of the people who flew the planes. And it was very, very poignant and very healing for people to have a place to talk about their fear and their grief. At some point later, President Bush decided to invade Iraq, Saddam Hussein, and there were a lot of a very famous psychodramatist, and Jonathan Fox was directing that night, and he said, just who are all the people, who are the players over in Iraq? And on the stage, he just had people stand up and say, you know, I'm a soldier, and this is what I'm feeling. Someone else said, I'm the mother of a child who just got killed, and this is what I'm feeling. I'm, you know, all the different. And then he said, okay, let's look about back here in the States. Who's in the roles? Who's on the stage? I remember one woman said, I'm the person who makes the body bags. That was a hard one for me to. I mean, I'm glad I wasn't directing that one. It was very deep, very painful. But all the different characters. And then he ended the sociodrama by having half the people on this side of the stage and half the people on that side of the stage. And we had lots of scarves. And he said, okay, the scarves are the bombs. You now throw them onto the people over here. And so we threw the scarves and people died. And then he said, reverse roles. And when the people who had died got up to throw the scarves, they were much more aggressive, which was very interesting to us. So those are some of the ways I've used sociodrama. I can tell you that sociodrama is really big in Europe and Australia, and it's also used, Ron Weiner, who's a sociodramatist in England, uses it to work with elderly people. He's not dealing at all with solving problems. He's doing sociodramas where he'll say, okay, you want a car ride to town, and he has the car. Let's see. Okay? And then now you have the car, but you don't want to take her. Who do you talk to? And before you know it, he's done a chain where everybody's talking to everybody in role. And it's just to develop a creativity. It's not about issues. There are as many different kinds of sociodramas as there are directors. Sociodrama, like psychodrama, always ends with sharing. So there's a warm-up, there's action, and sharing.
So you mentioned that sharing should be much longer than in psychodrama. Could you please say around like the percentage of warm-up, like how much time warm-up takes, action, and sharing in sociodrama?
Well, it's a hard question to answer because it's so specific to the purpose of the sociodrama and the group. So when I'm working inpatient, I don't worry so much about people walking away with things still unsorted out because
Oh, yes.
they're in a safe environment.
Yes.
If you're doing a sociodrama about things that are going to provoke a lot of emotions, you want to leave more time.
Yes, for sharing.
Yeah, I'm watching my eyes go like this. I'm trying to remember. I don't know that I could give you a specific answer to
and
that question.
I kind of realized that there is no. It depends on. If I would be asking you specifically about the group, you could probably come up with like, for instance, I don't know, like conference. Just conference. You see people first and last time, and it is just workshop.
How long is the conference?
Yeah.
How long is the workshop?
3 hours.
I would leave a good 20 minutes for sharing. Half an hour. Yeah. Yeah.
Okay. So.
And I might share an action, which is a whole other video. If I don't have enough time, I may say to the people, so when you're sharing in psychodrama, the protagonist, you're really sharing with the protagonist, and they need to hear what you have to say.
Yeah.
That's not true in sociodrama.
Yes.
Because there isn't a protagonist, right? Nobody
Right.
has just revealed themselves to the group and
Uh-huh.
needs to be, as Zerka said, reclothed, right? Sometimes in a sociodrama, you say pair off and share with the other person how this relates to your life. But you need to give time for them to do it.
When you pair people up, then you give each person possibility to share, and you at the same time you are saving the time.
Right.
Oh, that's good.
Let me give you an example. I do something where I can do it as a psychodrama or I can do it as a sociodrama. The idea of here's somebody who has decided they want to be sober. And what are their resources? Who's going to support them? Well, in a psychodrama, the protagonist says, well, I want my mother. And we'll say, pick someone to be your mother. And I want my AA sponsor. Great, pick someone to be your AA sponsor. And they reverse roles and they give the line because it's their story, right? When we end that and we do sharing, people need to say, what I related to was X, Y, or Z. In a sociodrama, the group creates the character and the group makes up, I don't say, the group has decided that the guy's name is Joe and he's 35. I don't say, Joe, who are the supports in your life? I say to the group, who's going to support him? And someone says, his AA sponsor. I say, great, come on up here and be his AA sponsor. So before you know it, the group has created the resources. And they've all made up their own lines for it. So when I ask them to share, I say, sit down. I mean, obviously, this is a group of people in recovery. It's not a general group for people off the street. This is a pointed group, right? I'll say, share with your partner some of the resources that you have in your life and some of the resources that you want to get, right? So I'm going to leave a lot of time for that because that's really important.
Yeah, I see.
Treatment has become, whether it's for substance abusers or psychiatric inpatient or day programs, have become very short.
Yeah.
The level of trust is much smaller. Right? And sociodrama is a great way to work on issues where people don't have to reveal so much of themselves.
Yeah.
And I really value it for that. There are times, I had a student who worked in an adolescent residential school. And she worked purely sociodramatically for months and months. And the kids did a lot of really good work. She did a lot of work on what in psychodrama is called a social atom. And the kids practiced how they would want to talk to the mother and the father, but they did it all sociodramatically. And they'd go home for the weekends and come back and report and talk about how it went, now that they had learned these new skills. After they were together for quite a while, someone said, I want to do my social atom. I don't want to do sociodrama. I want to do my story because there was enough trust in the group. So I think that sociodrama is a wonderful way in of itself, but also a way to work with a group that may eventually be able to work psychodramatically, but isn't ready yet because the trust level isn't there. The residential schools, the kids would be afraid to share their information because they go out from the units and the other kids would use the information against them. And that doesn't feel okay.
Yeah.
There's a lot of treatment in the world now that's psychoeducation. Social anxiety, groups for people with social anxiety. Social skills groups, right? Interpersonal effectiveness training, anger management, all these things. How much better to do it in action than to do it by just sitting and talking. People remember things when their bodies get involved. And that's what the sociodrama can do. And as I said, it can be used teaching 6-year-olds how to walk away from a fight, all the way to doctors at major medical centers learning how to talk to their patients more effectively. And everything in between. And we sometimes call that pedagogical sociodrama when we're actually teaching skills. Hi, I'm going to do a short demonstration of sociodrama with one chair that I was referring to in the video. Anna, who is the producer of these videos, and her friend Paul, and this is my husband Eric. But for the sake of this, they're going to be a group of people in early recovery. We got to create a character. So let's think about somebody, let's make up somebody who is getting ready to leave the program. Okay, they've been in program, so give me a name for this person.
Mike.
And how old is Mike?
Mike is 35 years
35, okay. And tell me, is Mike married? Is he single? What's Mike's
He's
story?
married, separated.
Okay, good. Okay. What's he been in treatment for?
Meth addiction.
Meth addiction.
Yeah.
Okay. So, can I invite one of you to sit here and be Mike, and you don't have to say anything?
old. I can do that.
Sure. Okay. So you're 35. You can enjoy that. What do you think are some of the things that Mike is feeling and thinking about as he's getting ready to leave program? Anybody have any ideas? Raise your hand. Okay, come stand behind Mike. Put your hand on Mike's shoulder and speak as if you're him.
Well, I'm so afraid to come back home. I've been in the treatment only for 45 days and I'm not ready to come back home.
Good, thank you.
I don't know what I'm going to do when I meet my old friends again. I'm really worried about them and bringing me back into my addiction.
Good. More?
I have lots of worries about my family, about my job, just worries, only worries. Mike is just worried.
I'm just worried.
Yeah, I'm just worried.
Just the stresses of life. I'm separated from my wife. Going home and having to confront all this again. It's going to be really tough.
Good. I'm gonna double something too. I'm really angry that the insurance company won't let me stay here longer. I'm gonna go some more.
I'm afraid that I'm going to relapse.
I hope that I have the strength to just get through every day. You know, it's very difficult.
I can handle this. You know, I can just use a little. I guarantee you at this point, people in the group are nodding their heads because that's a very common thought, right?
Yes.
I'll probably just smoke pot or something like that to keep me from thinking about the meth.
Yes, beer would be a good alternative.
Yeah. So you can see we start getting real, right? And if you have a group of 15 people, they're all jumping up at this point to
Yeah.
double. Okay. So that's one chair. Now, what I might ask the group to do is could you two come stand with me and come away from the doubling place, and from your position as group members, can you give Mike any advice?
Find a good sponsor.
Don't get back home. change your place of living.
Stay away from your old friends.
So what I might do now with a whole group is invite them to find a buddy and to talk about what their fears are and what advice that they would give themselves. And that might be a sociodrama group.
Yeah.
Okay? Good. Thank you. Come away. I'm going to do the next scene. Mike, have a seat. And who's somebody Mike needs to talk to about what he needs? Who's he worried about?
He's worried about his child.
His child. Now he's 35. Is his child a teenager?
Yeah.
Okay. Give me a name for Mike's son.
Ralph.
Ralph. And how old is Ralph?
Ralph is 15.
15. Okay. And what do you think Ralph wants to? What does Ralph need to say to his 15-year-old son?
He's afraid that his son will. He's afraid. He thinks that he saw that the signs that he's using also.
Okay. Okay. All right. So we only have 2 people to do the doubling right now.
Yes.
Because they're both in roles.
Yes.
Okay.
Yes.
So we're going to double for Ralph.
Okay.
All right. So why don't you start? Why don't you double for Ralph? What's Ralph thinking and feeling as he sees his father now that his father has come out of rehab?
Oh my God! Please leave me alone.
Mm-hmm. I know he's going to get on my case about my pot smoking. I just know it. And he and I are different. I'm not going to get addicted.
I should ask my mom and just move to my uncle to live with my uncle.
I'm really angry at my dad because when he was getting high, he was mean. Okay, so we have some information about what's going on with Ralph. And this is a chance for Mike to talk to his son. Okay, so can we double for Mike right now?
I'm really worried about my son, that he will do the mistakes which I did in my life.
So stay there as Mike's double. So Mike, that's every parent's fear. But you're meeting your son for the first time since you've been out of the rehab. And what is it you most want to convey to him? What are you feeling towards your son right now? You're worried about him.
Well, I just want to express my love to my son.
Ah.
Hi, son. I was missing you. I haven't seen you for 1.5 months, and I'm happy to see you.
Mm-hmm. Good. I'm going to double some stuff too. Okay? So I'm worried about his drug use. But what I'm going to tell you is I made a terrible mistake in what I did. And I want to repair our relationship. Okay.
That
So
was
I
very
would have the whole group do that.
Mm-hmm.
Okay? And then I might say, who'd like to take Mike's role and try it out? Okay? So we'll let you come out of the chair. And you go in and be Mike.
All right.
And you see if you can find a way to talk to your son. And I want the rest of the group to think about if you're Ralph, how would this feel for you?
Hi, Ralph. I really missed you. And I understand that I did many mistakes in my life. And one of them was in relationship with you. And I would like to work on a repairment of our relationship.
What's that feel like to you as Ralph?
I want to believe.
I'm not sure I can trust him yet.
I'm not sure I can trust.
Maybe I can tell my dad that.
I'm not sure I can trust you.
I understand.
Mm-hmm.
yeah, I did many things which I don't know if I could trust myself, you know. I can, but all what I can do right now is just to work on and just prove that you can trust me back. And that's what I want to do.
What's that feel like to you, hearing that, Ralph?
I'm hopeful.
Mm-hmm. Good. Okay. Thank you. And thank you. So after that sociodrama, I would invite the group members to talk to each other about who they need to make amends to, and about who they need to talk to when they go home in support of their sobriety. And that would take some time, because this is to get them warmed up to talking about this very painful stuff. I might ask them to imagine for a minute that they're the person that they need to talk to, reverse roles, and say what they imagine that person's feeling. Because that's how we learn to be effective in life, by stepping into the other person's shoes and seeing how they see us. We can make choices for how we want to behave in the future after knowing how our behavior impacts the other.
Rebecca, thank you so much for doing this interview. It was wonderful.
You're so welcome.
Thank you so much for watching, and see you in the next video. Namaste.